Hi everybody, Michele Kunz here. Today I'd like to have a discussion about shock. I'd like to talk about adults in shock and pediatric patients or children in shock. They're similar but different, and I find it very interesting talking about it with you. So shock is caused by numerous things, but I think the most common shock is hypovolemic shock. So you can imagine what the causes of that is. It could be gastroenterological, whether it's diarrhea and vomiting, and that is a common cause, especially in children as well as adults. Another big cause of shock is septic shock, and you know that is caused by a germ, a bacteria, could even be a fungal infection, but it's an infection. And both of those will look differently in our patients, but as long as we have an idea of what our assessment skills need to be, we'll identify that there are signs and symptoms of shock, and we really need to get a head start on treating them. Now, I know that adults and children do a great job at trying to compensate for this lack of perfusion. So you know that shock is a lack of perfusion of oxygen and probably blood as well to tissues and organs. It just does not meet the metabolic need of the body. And that could be devastating, after a period of time to our major organs. And the whole body, responds to this. Part of it is a reaction, part of it is compensation, but you have a whole catecholamine release. What happens is your angiotensin, renin-angiotensin system, activates. Your filtration, your GFR through your kidneys slows down, so your urine output is less. Usually we typically see it as, the heart rate increases. Those are our first signs. Blood pressure starts to drop, especially in adults, but not in children right away. So there are some of the differences I'd like to point out. But the biggest thing that we do to compensate for this is to vasoconstrict. So in hypovolemic shock, they're cool, they're vasoconstricted, they're tachycardic. Adults' blood pressure will start to drop. In all age groups, you'll see capillary refill is prolonged. And you know what capillary refill is. You squeeze the finger for a couple of seconds and the color should return very rapidly. But if that is delayed, that is a sign of poor perfusion. Typically though, in children, the first things we see is like an irritability. You'll see that in adults too, but we understand that when we see that in children. Adults and children alike will show signs and symptoms, like we said, the tachycardia. What happens is, besides the irritability, they might have some trouble breathing. So their oxygen supply, the body tries to increase the respiratory rate. So they're tachypneic as well. So their heart rate's fast, the breathing rate is fast. There are signs and symptoms of poor perfusion in the peripheral areas. And on adults, even with a 15 to 20% drop in blood supply, like in hypovolemic shock, where it not is just diarrhea and vomiting, it could be blood loss. And that can be in children as well, we know that. But even with a small percentage of blood loss, 750 cc's, 1,000 cc's, we start to see a blood pressure drop. But then I mentioned before, in the pediatric patient, you'll see all the other signs and symptoms of shock developing, but that blood pressure, they do a great job at vasoconstricting infants and children. So their blood pressure doesn't show that sign of hypotension right away. And I know when we care for adults, that is one of the first signs that we see, and we know that we have to move on that. So remember, it's not always the blood pressure that's telling you about shock, it's all the other signs and symptoms. The tachycardia, tachypnea, restlessness, slow capillary refill, or prolonged, I should say, lower urine output. These are the things that we have to start working on. And if it is hypovolemic shock, we have to start giving fluids. On adults, we're giving, liters at a time sometimes to replace their fluid. In pediatric patients, it's always by weight, you know that. And it's usually about 20 mLs per kilogram as initial bolus, depending on their weight, of course. If it's septic shock, you might have the same and similar signs and symptoms, but instead of cool and dry, they're more like hot, maybe moist. So they have the fever. They still also have the signs and symptoms of dehydration. So yes, we are treating them with fluids, but then of course we have to culture them and treat them with the proper antibiotics. So treatment is another whole program for shock. But to identify shock is very important in adults and in the pediatric patient. So hopefully this is initiation into discussion and learning more about shock. But definitely there's a difference in adults and children related to that vasoconstriction response. But as long as we're looking for the signs and symptoms very early on, you can catch any patient with early signs and symptoms, and that's when you have to start treating shock. See you in my next video.